My name is Evelyn Oyelamte, and I am an air traffic controller with the Ghana Civil Aviation Authority. Pleasure is mine to be your moderator for today. Do you know that air travel is the safest and fastest mode of transportation? It will interest you to know that about 100,000 flights around the world take off and land every day. And in a year, over 4 billion passengers travel by air globally. The safest of air travel is largely attributed to those professionals called air traffic controllers. Today being 20th October, is a special day in the life of an air traffic controller. It is a day set aside to mark the International Day of an Air Traffic Controller. Air traffic controllers are the unsung heroes of the skies, working
silently behind the scenes to ensure the safety of countless flights every day. Their role is not only demanding, but also immensely stressful.
I would like to take this opportunity to say happy anniversary to our gallant air traffic controllers all over the world. We want to celebrate and appreciate you for your unwavering commitment to keeping our skies safe. Your skills and professionalism are the pillars of aviation safety. Congratulations. We say, Ayiko. If you have just joined us, kindly introduce yourself and where you are joining us from in the chat box, and I will be glad to acknowledge you accordingly. We begin today's webinar with a word of prayer. Father, Lord, we thank you for giving us this day and making it possible for us to meet here. We pray that you guide and guide us through. Amen. The aviation industry represents a complex and dynamic environment where the mental health and well-being of personnel is paramount to ensuring the safety and efficiency of operations. It places unique demands on individuals, from pilots to air traffic controllers, cabin crew, maintenance personnel, as well as other aviation professionals, which exposes them to high-stress situations, such as irregular working hours, long periods of isolation, intense decision-making, and the weight of responsibility for passenger safety. This can therefore contribute to stress, anxiety, and other mental health challenges, potentially compromising safety and performance. We understand that talking about mental health can sometimes be a sensitive and personal matter. However, it is our hope that this conversation serves as a safe space for open dialogue. To help us gain a better and clearer understanding of today's topic, we are privileged to have seasoned professionals who will share their valuable insights and practical strategies on this crucial topic. A special welcome to our distinguished speakers. Thank you, gentlemen, for joining us. Before we delve into the discussions, let's remember that today's conversation is just the beginning. We hope to better understand the challenges faced by aviation professionals and to equip ourselves with practical tools to manage stress and promote mental health. With that said, I'd like to introduce our first speaker. Hold on. Before then, we'll have a surprise guest speaker. Our speaker for today is an expert in aerospace medicine. He is the medical director of Care Flight Ghana and an associate fellow, Aerospace Medical Association. He is the first Ghanaian aerospace medicine specialist and a graduate of the Division of Aerospace Medicine, Rice State University, Bonshoft School of Medicine in Ohio, King's College London, and the Royal Air Force Center of Aviation Medicine. He is an aviation medical examiner for the Federal Aviation Administration of the USA, Civil Aviation Safety Authority of Australia, South African Civil Aviation Authority, and the Ghana Civil Aviation Authority. He enjoys flying and cycling. We are delighted to have Dr. Isaka Yakubu Akparibo with us today to discuss this vital topic. Ladies and gentlemen, please join me in welcoming Dr. Isaka Yakubu Akparibo to share with us his insight on medical health and stress management in the aviation industry. Dr. Akparibo, the virtual stage is yours.
Hello and good morning for you all, and thank you very much for the opportunity. Can you see my screen, please?
Yes, we can.
Okay, sure. Thank you.
Thank you.
So I'm going to speak on mental health and stress management in the aviation industry. So I have no financial disclosures except that I am an AME, as you mentioned in your introduction. So I'm going to speak on some of the stresses that cause mental illness among aviation personnel. We'll be looking at job-related stresses, personal stresses, and then I'll also look at the common mental conditions that we find amongst aviation personnel, and then I'll take questions. So by the end of this presentation, we should be able to know some of the common stresses that lead to mental illness in the aviation industry. We should appreciate the peculiar nature of the aviation environment, and then we should also know some of the mental health conditions and the coping mechanisms. So as you mentioned in your introductory remarks, the passenger numbers and flight length has increased over the years. These days, when you go to our airport, our international airport, Kotka International Airport in the evenings, you see that the whole place is packed. You can't get even parking space to park. That tells you that the passenger volumes has increased a lot. Now, Boeing did an outlook forecast, and this was in 2016, and they found out that by 2035, the aviation industry will supply about 2 million new aviation personnel, and pilots are going to be about 62,000, maintenance technicians and about 64, and then the cabin crew about 81,000. So aviation, as you mentioned, is the major mode of transport, and persons working in aviation, especially pilots and air traffic controllers, need to be mentally and physically fit in order to carry their duties safely. We know that the machine hardly fails. So our control equipment, the aircrafts and all that normally don't fail. It's always, most of the time, it's human error that causes aviation accidents. And we know that about 90% of aviation accident is caused by human error. The mental health of aviators is a major concern for airlines, the regulatory bodies, and then passengers. This is so because problems among pilots, especially, is a threat to flight safety. And the results of psychological illness can be a catastrophe, as we witnessed with the German wings incident in 2015. So the Aerospace Medical Association, which I'm a member, formed a working group on mental health after the German wings incident and had made recommendations to ICAO, the FAA, IATA, and then the Airline Pilots Association, and most of the major regulatory bodies in the world. The prevalence of mental health in the general population is about 10%. That is the Ghanaian population. So that means one every 10 persons probably will have an episode of mental illness in a year. Now, the incidence in the aviation industry is difficult to determine because air crew are mostly reluctant to disclose mental illness for fear of losing their licenses. So what are the common stresses that normally cause mental illness amongst the aviation community? One is the nature of crew selection, the nature of the training, and even how to maintain your license. The medical standards and requirements on the aviator, there are job stresses, and then also personal stresses. So we'll look at these stresses individually. So airline pilots and ATCs are evaluated regularly throughout their professional careers to ensure that they are fit to fly or work. I haven't seen any occupation that undergoes regular medicals than in the aviation community. Even with medical doctors don't undergo this kind of rigorous medical checks. We know that for a Class 1 pilot, you must have annual medicals yearly until when you are 40. And then from 40, you have medicals every 6 months until when you are 60 or retirement. With air traffic controllers in most jurisdictions must have also yearly medical exams. And cabin crew also is yearly. So the license of an aviator is a precious possession. So after going through all this training, to have like an airline transport pilot license or a CPL, the student pilot will have to pay about $100,000 or more in order to complete the course. You must pass a technical exam, complete a practical training, and pass a practical test. Now, after undergoing all this, you need to also do certain things to maintain your license every year, which will include passing an annual medical test again. You do a simulator test flight. You have to have a line check. You have to complete an open book technical exams, and then attend annual training. So you can see that the life of an aviator is so packed. You know, you need to undergo all this in order to do your normal work. So all this puts a psychological strain on the aviator. So what are the job-related stresses? So we know that the working conditions in which pilots or aviators undergo is very physiological and mentally challenging. So a pilot sits in this confined space in the cockpit, and you're supposed to be there for about 10 to 13 hours for some of the flights with poor air quality. There's background noise, you know, so all this puts like psychological strain on the aviator. With ATC, you have to sit next to your radar equipment, you track aircrafts, and you just sit for like several hours with just intermittent breaks. So because of the nature of the job, like the monotony causes like some kind of puts a strain on your mental health. We also have like irregular working hours. So mostly you have to wake up very early and then close late. Also, currently there are some economic situations that also put a stress on the aviator. Sometimes there are job uncertainty, so you don't know whether your job is going to be maintained for the next 2-3 years, So because of the economic impact, then some people also get stressed from that. The post-pandemic increased demand for air travel has also put much workload on current pilots. If you follow the trends during the summer, the FAA in the US ran out of air traffic controllers. And because of that, over 1,000 flights were canceled daily in the US. Now, let's look at the personal stresses that can also lead to mental illness. When we say personal stresses, we mean things that occur outside of the workspace, which can affect performance at work. So as aviators, we are just like the general population. We also have responsibilities and obligations. We have to attend funerals, we have to pay children's school fees, family difficulties and all that. And so aviators, we are not like insulated from the normal stresses from the general population. Now, let's look at the common mental health conditions in aviation. Most of the information on mental health that we get from airmen are normally gotten from air accident investigations. An accident happens, and during the investigations, then we detect that a pilot or crew member probably had some mental illness. We also get information from AME records, and then from also regulatory bodies like the Ghana Civil Aviation Authority. Now, in a study in Brazil, about 24% of participating pilots with a heavy workload had possible common mental disorders. Now, most of the conditions are treatable, but like I said, pilots normally don't want to seek for help because they fear that they will lose their license. The most common condition among mental condition among aviators is depression. Now, depression is a mental problem that involves having low mood or losing interest and enjoyment in things. So it starts as sadness, then the person will describe or say that, oh, I feel myself shutting down, becoming less capable of coping. Eventually, the person just feels numb and empty. Now, all of us can have this kind of feeling at some point in our lives, but it becomes depression when it continues for several weeks, and then it makes us incapacitated, or we're not able to do our regular work. So how do we identify somebody who is depressed? What are the signs and symptoms? So the person will feel down or upset, will feel restless and agitated sometimes, and then has some sense of guilt and worthlessness. Then the person will become isolated and unable to relate to other people. Sometimes gets angry or frustrated with just minor provocations. And then you also feel or have like your self-esteem is going to be low. And then you feel tired, yawning all the time, and you have like less pleasure in things that you normally enjoy. So because of that, you could now start avoiding your colleagues or social events, and then you have like self-harming or suicidal tendencies. You think that, oh, life is not worth living. You feel like just ending your life, and then you also lose interest in sex. There could be weight changes, like either gain weight or lose weight, and then appetite changes. Your appetite could either go down or also increase, and then you tend to start using illicit drugs or drinking a lot of alcohol. Depression is also associated with sleeping problems. So how do we identify a crew member that has depression or some of the mental conditions? So generally, you see that a pilot that normally performs very well suddenly performs below his or her standard in training or line checks. The person will start having constant, like mostly getting excuse duties here and there, missing jobs, and then reporting to work late. And during safety management system situation, the pilot definitely will have issues and always have reports coming in about violations in procedures and protocols. And then the colleagues of the aviator may have difficulty working with the person. So if say air traffic controller, like most people wouldn't want to be on duty with the person. And with pilots or cabin crew, you see that when they put the person in the roster, then the colleagues would always try to avoid that person because they think maybe the person is difficult. But it's not that. The person probably is also having like a mental breakdown. Normally, crew members that have had traumatic situations like losing a close family member, having financial problems, divorce and all that, are also red flags that we need to look for from our colleagues. So what do we do if we start to experience this kind of symptoms? You need to talk to someone that like a confidant of yours, someone that is very close to you. You also need to seek for peer support. And then if your company has employee-assisted programs, you need to also call them. So I'll go through this in detail later. The second mental issues that we see in aviation is drug and alcohol abuse problems. Problematic use of alcohol or drug is linked to poor mental health. And alcohol use increases absenteeism and then presenteeism. Person comes to work and pretends like he's working, but nothing is being done. Now, certain working conditions like in aviation is associated with alcohol and illicit drug use. So you have like shift work, night work, and then working away from home, like away from the family. So most of these like predisposes the aviator to taking illicit drugs and alcohol. So what we need to do is to have like an alcohol and drug policy at the workplace. So other mental issues that we see are anxiety disorders. Schizophrenia is very uncommon in aviation, adjustment disorders, and then also mania. So the mental health issues that we see in practice in Ghana here also are these three: depression, substance abuse, and then post-traumatic stress disorder. So what do we need to do to maintain an optimum mental health? We need to try to put in measures to avoid incidents from happening. We don't have to wait until the person gets a mental breakdown before we put in fatigue management measures. So we need to also create mental health awareness at the workplace and then offer educational workshops. So there are some of the projects that employers and then also peer groups like the pilot associations have developed to help aviators who have mental issues. The first one is the Project Wingman. This is a program that was designed by the American Airline Pilots Union. So what it does is they create like a room for pilots to seek for help anonymously. So the pilots contact psychologists anonymously, and then they try to manage the person and then give support and get the person back to work. Another program is a human intervention motivation study. This is a program which is run by the FAA in the US. So what they do is if a pilot is identified or an air traffic controller has mental issues, the person sees a HIMSS-trained AME, and then the person is then taken through a program which normally lasts between 6 to 1 year. And then the crew member is then returned back to work. So these are designed so that aviators will have like confidence in the system. So they'll know that even if they have mental illness, that isn't the end of their career. You only be grounded for some period, and then you'll be put into a program, and then you get back to your normal flying duties. Another program is the employee assisted program. So with this, and then make a report, and then the clinical psychologist will then take them through the management. So I'll conclude by just mentioning some of the mental issues that have been or that have caused problems in aviation. JetBlue had a problem. There was a 49-year-old captain. They were flying from New York to Texas, and then the captain started like preaching and then threatening that there's a bomb, and then they had to restrain him, and then the flight diverted and landed in Amarillo, and the crew member was removed, and it was found that he had a mental breakdown. Another incident was the Air Canada one that occurred in 2008. So they were flying from Toronto to London, and then a 58-year-old co-pilot started talking to God. He became belligerent, and then the captain, they had to lock him out of the cockpit, and then he was then subdued, and the flight diverted and landed in Ireland, and the crew member was sent to hospital. And the popular one we all know is the German wing case that happened in 2015 that killed all the passengers and crew on board. Now, there are some other aviation incidents that we suspected were due to mental illness, although it wasn't conclusive. So like Japan Air, I think their DC-9 crashed, and it was suspected that the pilot probably deliberately caused the accident. Also a Royal Air Maroc flight, and then the Egypt Air incident that happened in 1999. I think the cockpit voice recording showed that the pilot probably committed suicide, but Egypt Air also didn't agree. So these are inconclusive incidents. So I'll end here, and then I'll take questions from you. Thank you very much for the opportunity.
Right. Thank you, Doug, for your insightful presentation. We really appreciate your time spent with us and educating us on this vital topic. We are very much grateful. We would want to take the other presentations before we come to Q&A questions. I want to acknowledge some few attendees, the early birds. We have Mr. Anthony Samani from Ghana, ATC, Jacqueline Atushie from Uganda. If you have just joined us, kindly introduce yourself and where you are joining us from in the chat box, and I'll be glad to acknowledge you accordingly. Thank you for being here, and let's make this conversation an enlightening and transformative experience. Without further ado, I would like to introduce our second speaker. Our second speaker for today is a licensed psychologist who holds a Master of Philosophy degree in clinical psychology from the University of Ghana. He is a long-standing member of the Ghana Psychological Association. He has 10 years experience and has helped clients from all walks of life with various mental health challenges. He is a senior psychologist at the Trust Specialist Hospital. He consults for several corporate institutions, including financial, mining, utility, educational, health, among others. He is a stress management specialist at Psyconnect Ghana Limited, a psychological well-being company. He is the author of Living Today Now, The Power in Positive Thinking, and the co-founder and editor-in-chief of Happiness Digest, a half-yearly magazine on happiness. He is a great public speaker and currently pursuing a PhD program in psychology. He is dedicated to helping and empowering clients solve their mental, emotional, and behavioral problems, as well as manage their stress to promote well-being. We are delighted to have Mr. Eric Huwosukumi with us today to discuss this vital topic. Ladies and gentlemen, please join me in welcoming Mr. Eric Huwosukumi to share with us his perspective on the topic. Mr. Huwosukumi, the virtual stage is yours.
Thank you very much, my sweetheart, Evelyn. And good afternoon, good morning to everyone who is listening or viewing us. I think she has done the introduction, and I thank my friend Dr. Aparubu for his great presentation. So you've heard a lot from him. I will just continue from where he left, so that we can see the other parts of our mental health issues. Okay, so I'll be taking you through some few things on mental health. He has mentioned a lot of things under mental health, specifically to aviation. And the part he mentioned that interested me most, that I want to continue from, is we are only a subset of the general population. And so apart from the specific things he's mentioned that affect our mental health or in the aviation industry, I'm going to take you through other things that affect our mental health. So without much, I wanted to look at our right to mental health, what mental health is, some common mental health illnesses, and then the mental health continuum, the link between mental health and mental illness. Then we'll look at technology and mental health, and then we'll see how powerful all of us are. Okay, so the WHO on the 10th of October has set this day aside to celebrate Mental Health Day. However, the whole of October is for mental health as well, and a lot of conditions and a lot of issues, including Aviation Day and then breast cancer days. So everyone is expected to have the right to their mental health. And the WHO is saying that this year it is focusing on our mental health, and that we all have the right to the highest attainable standard of mental health. The right to be protected from mental health risk. So I will be talking about some of the risks to our mental health. The right to available, accessible, acceptable, and good quality care. And the right to liberty, independence, and inclusion in the community. And so whether we have mental health or not, we have the right to be part of the community. We don't have to be isolated, as is done in some years ago, and it's even currently happening. So let's quickly look at the state of mental health. Yeah, hello.
Sorry to interrupt you. Would like you to go full screen so that our viewers can have a full view of your slides. Thank you so much.
Okay. So let's look at the state of mental health in Ghana. Because we are talking about our right to mental health, it's important we understand some of the statistics. 2% of people living with mental health conditions receive care. So it means that if there are about, I think we're about 70% here, or even if you are 100 people, it's only 20 people, no, 20, it's only about 2 people who are receiving mental health care. So if you are 1,000, then it will be about 20 people, which is very, very dangerous. And so if we, people working in the aviation industry, are part of this population, and only 2% of us are receiving care, especially those of us who have a diagnosis of mental health condition, then we are in trouble. So let's be mindful of that. And then all of us support education to help our policymakers, our churches, our institutions to make mental health care a priority. And then also about 10% of us, the whole of Ghana, suffer from some form of mental illness, 10% of us. So if Ghana's population is close, it's about 31 million, then you can imagine that 310,000 people are suffering from mental health issue or have mental health disorder. Then also 13% of the adult population, that includes you and I, because you are an adult. Everyone of us in this association is an adult. 13% of us in this Ghanaian population suffer from mental health issue. Then 41%, this what when people hear, they get apprehension. 41% of Ghanaians are currently experiencing psychological distress. And so the question is, the difference between a mental disorder or a mental illness and a psychological distress. So the psychological distress is a milder form, it's very mild. And so for instance, if you are living in an abusive marriage, okay, you've not been diagnosed of depression, anxiety, or a post-traumatic disorder, or you are not abusing alcohol to the level of a mental health issue, then we will say that you are suffering from a psychological distress. And so at that level, you are so distressed that you are not able to function at the optimum level of your functionality. So that's why we have that high number of people. Then when this condition is present, now let's look at the people in the mental health industry who are supposed to take care of us. Remember in the initial, the first statistic I gave was 2% of people who have mental disorders receive treatment. Now let's look at why this is happening. Now, the highest number of people or professionals in the mental health industry are psychiatric nurses. And so in Ghana, we currently have about 2,463 of psychiatric nurses who are supposed to support other professionals to take care of mentally ill people. Then when you take them out, then there are only 362 mental health social workers. So these are also people who are trained. They are usually supposed to visit people in their communities, in their homes, to show that they are taking their medication, or visit the community to show that there are people suffering from mental health challenges, so that they can bring them to the facilities for treatment or support them out there for treatment. Then psychologists, especially clinical psychologists, health psychologists, counseling psychologists, we are about 244 people, including myself. So if you do your calculation and then share these people among the population, you can imagine the number of people who can get access to psychologists to help them manage their mental health situations. Then you come to the psychiatrists, the doctors who are trained in mental health, the specialists in mental health. We have only 39 of them. So if you have to distribute these people among the 16 districts and regions in Ghana, and then again distribute them along the so many districts in Ghana, you can imagine how many of us can see psychiatrists when we are in deep trouble in terms of our mental health. Then there are only 4 occupational therapists. So the occupational therapists normally help people to when they are recovering from their mental health states, so that they can reintegrate them back into society, into family, into work places. So with this in mind, let's quickly look at the risks for poor mental health. Every human being on earth, including Ghana, and then specifically to air or aviation workers, we are all at risk of mental health. There are some of the factors that we don't control. There are others that we have so much control over. So let's talk about low socioeconomic status. So the poorer you are, the more chances that you have a mental health difficulty. Because just yesterday I was discussing something with one of my lecturers about the definition of some mental health conditions. And then we realized that for Ghanaians, most of them is because of money, it's because of poverty, it's because they don't know what to eat, it's because they don't know when and how they're going to pay their children's school fees, how they are going to pay their medical bills, and this can sink them into depression. Whilst in developed countries, this is not the case. Their risks are different. Their risks are completely different. So lower socioeconomic status can plunge us into having mental health difficulties. Then also there's some medical conditions that can predispose people to mental health. The common ones are the cancers, the liver diseases, the kidney conditions, the HIVs. So conditions that are chronic can predispose people to mental health challenges. Even when you take this, the major ones I've mentioned, even diabetes and then hypertension alone, for some people, these conditions make them depressed, make them scared, anxious about life. They make them anxious that you're going to have the complications of diabetes and then hypertension, like the stroke and then the heart attack. So they get worried for a very long period of their life unless they are managed. Then being female is also a risk factor because naturally there are genetic differences between men and women. There are hormonal differences. And then when women become pregnant, there are hormones that are overproduced or that are produced to support the pregnancy. When they deliver, they also have hormones that will support breastfeeding and support the younger baby. And all of this predispose them to mental health challenges. So for instance, my wife has just delivered and she went through a lot from threatening abortion at the initial stages. Then when the baby was 20 weeks older, we saw that the cervix was open and so threatened further abortion, and she has to be in bed out of work for over 3 months before delivering. The delivering to the baby had complications, he couldn't breathe well. So all these factors are directly connected to the woman. Even though I'm part of the game, I also play the role in the child being placed there. It is not inside me. So I could go to work. There's no way I was going to be given leave like 3 months because my wife was going through this difficulty. So she had to suffer all this emotional torture alone. So that is why we are saying that being female also predispose women. And then, of course, we can talk about the postpartum depressions and then other conditions that women face because of pregnancy. Then there's genetic factors. So for some of us, we have family history of mental health difficulty. So the fact that you are born into a particular family, that gene can make you to be predisposed to a lot of mental health conditions. So for instance, when they do gene and twin studies, they've seen that for some twins, no matter where they are located in the world, they all suffer depression or anxiety. And so that gives us evidence that for some people, because of their family background, they are going to be exposed to mental health issues. Then educational level. So the less educated you are, the chances that you have mental health challenges is very high. And so, for instance, highly educated people like us have this opportunity to learn about mental health issues. This is not applicable to those who are pushing trucks, those who are selling in the traffic, and those in the Mokola markets. The chance that you have this opportunity is almost like zero. And so aside that, when you're highly educated, you get highly paid job, you are more likely to have access to clinical psychologists or hospitals that will help you to manage your stress level, to manage your health conditions, pay for your health conditions so that you don't get mental challenges that are due to low socioeconomic status. Then also bad relationships. So all kinds of relationship. So the relationship we have with our family members, our spouses, our children, our work, our supervisors, our superiors, our other people in the world can predispose us to mental health issues. And so as I speak now, those who find themselves in bad relationship with their bosses, with their partners, can attest to how this is affecting their mental health. The Mental Health Authority was set up some few years ago. So you can imagine Ghana, we just started being serious with mental health. Okay, clinical psychologists were employed into hospitals recently, just about 2 years, 3 years ago. Kolebu had a lot of clinical psychologists. Initially, there was only one clinical psychologist serving the whole of Kolebu. And so this person was overwhelmed. When you count my facility, I'm the only one here. The others only come to be trained, so they leave us as and when they are finished with their training. And so and then we are aware that when people have mental health issues, and then they are stigmatized, they are abused in so many forms. So you can have people who are chained in prayer camps. I've had experience with a gentleman who was chained for about 3 months together with other people. And according to him, the other guys died because you have to confess you are a witch or a wizard. You have to confess that you are the one causing the problems, killing people, causing sicknesses, before you are even fed, before you are allowed to go and poo-poo, before you are allowed to go and wee outside. Other than that, you do everything where you are chained. And this is the dehumanizing. And so the Mental Health Authority is mandated to protect and promote human rights of people with mental health conditions. And so the Act currently criminalizes the violation of the rights of persons with mental health disorders. And then they also have to work to reduce the stigma and the discrimination that people with mental health issues face. So the fights, we have to fight against discrimination, we have to fight against stigma. And this starts with the public, it starts with the system. So the whole public, all of us, when we find ourselves on the street and somebody is abusing anybody who is mentally unstable, especially those with schizophrenia. Those we see on the street, most of them have schizophrenia. A few also have psychotic depression that makes them see things that they're not supposed to see, hear things, voices that they're not supposed to hear. And so they respond to them and you find them going to places they're not supposed to be. So all of us have the duty to protect these people, support them, and then get them treatment that is needed. Then the systemic discrimination must also be taken care of. In some cases, like Doc mentioned, a lot of pilots will not disclose or not even report when they are suffering from mental health issues. When they begin to have symptoms, they will not report because they are scared they will be sacked. And that's the system. So in some institutions, when people have mental health difficulties, the first thing they do is to take them off the system. And some of them will push them off. But I want to assure you that the Mental Health Authority or the Mental Health Act is protecting every one of us from being stigmatized or discriminated against because we have a mental health issue. So we'll come to where we realize that when you are treating a mental health issue, you are as healthy as any other person who is also treating malaria or treating a cough, and that we believe the malaria will be treated and will be healthy to be able to function again. So the same thing applies to mental disorders. Then ourselves, so the person or the individual suffering from a mental breakdown, suffering from a psychological abuse, an emotional abuse, anybody going through a psychological trauma should not stereotype themselves. Don't abuse yourself, don't beat yourself up, don't blame yourself, don't think you are the cause of all the worst problem. Seek for treatment. And so the stigma can be from ourselves, can be from the system that are in place, and can be from the whole public. And so we should be mindful of that. Now let's look at what mental health is. Very important. Mental health, that is, if you're not sick mentally, you have mental health. We should remember that it is the overall well-being of an individual's emotional, psychological, social state. So it includes how we think, how we feel, and behave. And this plays a critical role in our quality of life. So for you to enjoy life, you don't need to only be having a headache-free life or malaria-free life, or you're not having a kidney problem, or you don't suffer from cancer. You must have an emotional stability. You must have behavior stability to be able to enjoy life. Remember that there's no health without mental health. Ladies and gentlemen, a good mental health is more than the absence of a mental impairment. So a good mental health is not just not the presence of so not just organic sickness, but you have peace of mind to make decisions, to implement decisions, to come decisions that you make. So when you start something and you're able to see it through to its completion, then we can say you have mental health. So Doc has mentioned a number of them. So these are some common ones that we see around: substance use disorder, there's bipolar and related disorder, there are anxiety disorder. A lot of anxiety disorders, some of them are post-traumatic stress disorder, there's generalized anxiety disorder, there's health anxiety, there are people who are scared of certain animals, there are people who are scared of blood, there are those who are scared, there are even those who are scared of the BP machine, there are people who are scared of the hospital. These are all specific types of the anxiety disorders. Then there are the dissociative disorders. There are some conditions that make the person to be disconnected from reality, disconnected from themselves. So some people may not remember their names, where they live, what they even do, with their families they come from. They can't remember things that they have acquired, the skills and the knowledge that they acquired. So we call these ones dissociative disorders. I'm sure you've heard about split personality, where somebody can live in Accra as a medical doctor. He leaves Accra, goes to live in Bolga or another place, and he lives complete. Can't remember he was a medical doctor. He lives and he can live there as a farmer for the next 10 years. So these conditions happen, and it happened to any one of us. It's important to know that it is okay to not be okay. So it is normal not to feel normal. It is okay to feel sick, to feel overwhelmed, to feel that you can't control anything, to feel that you can't do anything. It's okay to feel like you can't remember anything. Don't fight it when you feel not okay. Seek for help. So the anxiety disorders, these are some of their characteristics: extreme fear, worry, uneasiness. Some people have attention difficulties. Some also have panic disorders. And then the depression, these are some of the types: major depressive disorder, and the postpartum that is common to happens after childbirth. Then there's seasonal affective disorder. It happens usually in the temperate zones. It's not here. It is they're not able to buy power or gas to power or to heat their rooms. So the moment they heat, the weather becomes very warm, cold, they get depressed because they won't be able to sponsor or buy power to take care of their, to keep themselves warm. Okay, so the moment the weather changes over, the season changes over and the weather becomes very warm, they heal, they become better. Then dysthymia is a kind of depression that has stayed on for over 2 years continuously. Okay, it's not as severe as major depression. It is mild, but it is with you for a very long time, basically chronic. So the person is depressed for a very long time. Then there's the self-image or self-esteem and body image disorders. It's very common among women because women worry more about their self-esteem and their body. So the woman can worry about the nose, the eye. Currently, I have a client who has multiples of body image challenges. So she's not happy with her fingernails. She's not happy with her nose. She's not happy with her forehead. She's not even happy with her teeth. And so when you have these conditions and you are not confident if the way any part of your body is, we consider that you have a body image disorder. And so even though it's common among women, some men also have this condition and they want to do everything to see changes in these body parts. For the substance abuse and addiction, there's the almighty alcohol addiction. Then some people are also addicted to drugs. Some are addicted to other substances like marijuana, some with tramadol, which became an issue, a topical issue on our airwaves. Then there's those who also have dual diagnosis. So they are abusing a drug and then they also have depression or anxiety. So we call that a dual diagnosis. So the two of them are happening at the same time. Then there are those who are also supposed to go through rehabilitation, and then they have to go in and out of the rehab centers and only to come back and then abuse drugs again. Post-traumatic stress disorder can happen. You remember the accident that happened, the aviation accident that happened on the 37 Bema Camp or Labadi Road so many years ago. Okay, so there are people who have not recovered from that condition to today. Then there is the Melcombe disaster, the Circle fire and flood disaster. Then we also know about the stadium disaster that happened at the Accra Sports Stadium. So these disasters lead some people to have what you call the post-traumatic stress disorder, which is usually diagnosed after 3 months of the event. Apart from this group, the disasters, there's also specific ones. So people involved in motor accident, people getting their places burned up can also experience this disorder. So even though these disorders can happen to us from home, we can bring these conditions to work and then it will impact our functionality and performance at work. There's the sleep and mental health also. So for some people, they're not able to sleep could be because of a medical condition. It could also be as a result of the medication they are taking to treat their medical condition. It can also be as a result of psychological challenges or stress-related problems. And when you're not able to sleep, it affects the quality of your life, your functionality at work. You may have to sleep at work, or you won't be able to have attention. You may have neck pain, back pain. You may even have hallucinations. So there's sleep-induced hallucinations that can happen. When people are deprived from sleep for a long time, they begin to see things and begin to hear things and feel things. Then the eating disorders, also common among women a lot. So there are the anorexia, and then there are the bulimias, the binge eating disorders are also common. Then there's bipolar. Bipolar means that you have two in one condition, two in one mood disorder. So one of the disorder makes you to become hyperactive, function at a very high level, do so many things at the same time. You are building, you start foundation to put up a 3-story building with just 100,000 Ghana cedi. So it means that this person couldn't think through because the energy level is so high, and then he's restless and a lot of thoughts are running through his mind. So anything that comes into his mind, he wants to implement it. Then the other side of the pole, which is the other part of the bipolar, is the depressive, where the person crashes down. So from building, he stops the building completely. He doesn't think about it. He doesn't want to talk about it. He doesn't want to go to the site. So the same thing applies to any project that the person starts. It could be schooling, or work. He doesn't want to go to work. You have to force him to go to work, and he's not contributing and supporting anybody at the workplace. Then, so let's talk about the mental health, the mental disorder continuum. So on the right side of the screen, that's my right side, you have a table, like a quadrant, 4 of them. So with the mental health well-being, some people can have a mental disorder diagnosed and still be functioning because they are taking their medication and then they are doing all the things that their mental health professional has taught them to do. So they are functioning, they are flourishing, they can go to work, they can perform, they can excel, start something, finish it excellently. Okay. Then there are those of us who have no diagnosis. We are not sick mentally, but we are struggling to survive because of stress or because of parental difficulty, sickness, because of maternal challenges. We're not able to function. Okay, so we are also suffering. We are also on one continuum. Then there are those of us who have a diagnosis of a mental health disorder, but because we are not on any medication or on any treatment, we are struggling to function at workplace, our relationship with family members, with our wives and husbands, our children. We can't function. Then there are those of us who have this condition, but because we are taking the medicine, we are suffering. So when you look at on the screen, you will see where I've ticked correct. Now, where I've ticked correct, on top, you see mental well-being. Below, you see no mental well-being. So if you look at the, let me pause. So if you look at the right-hand side, the extreme right, you have no mental illness. Then at the top quadrant, you see mental well-being. So between mental well-being and then no mental health, that's where you have the green correct. It means that the person has no mental illness and then he's flourishing. He's able to function, do everything correct. Now, in the other four quadrants, that's where the problems are. On the extreme left of the correct, you will see mental illness on the bottom. Okay, so the person has mental illness. So because he has mental illness, he is not flourishing. He is occasionally going in and out of mental health facilities or how to restock his medication. But his case is better than the one below him or her. So the one below has mental illness and then he has no mental well-being. So on the extreme, on your left down of the quadrant is where you have the person who is struggling the most. Okay, so he has mental illness, then he has also no mental well-being. So if you have no mental well-being, we consider you that you are lavishing, you are struggling through a lot of things. Then on the extreme right, on the right lower from where we also have the cross, this person has no mental illness, no diagnosis, but he is not functioning, he's lavishing, he's going through a lot of difficulties. Like I mentioned, marital problems, maternal issues, family problems, the father is sick, the mother is sick, he's the only one working, so he has to do a lot to send money home. So he's languishing, but he has no mental health issue. Now, how does these things play in mental health? I started by saying that there's no health without mental health. There's no health. Now, depression increases the risk for many physical health conditions. If you are depressed, okay, you are more likely to become diabetic because you may eat anyhow or may not eat at all. You are more likely to fall and break your limbs, so you become sick physically. You are more likely, if you have a medical condition like stroke or diabetes, you're more likely to refuse to take your medication. And so the diabetes or the hypertension becomes severe and you can get a stroke or a heart attack. So because of mental illness, it is affecting your physical health. In the same way, somebody suffering from a health condition like diabetes, a heart attack, or a stroke, who didn't have depression, may become depressive or anxious because of the physical illness. So the continuum states that the two of them interact to make us healthy. So if you have no mental health condition and you have no physical condition, you have a better health condition than somebody who is suffering from this one. Now let's look at this slide. Look at the heavily deprived desert zone. So there are cracks, severe cracks on the ground. And then look at a tree flourishing in the middle of this place. Now, this is to exemplify someone suffering from a mental illness, but he's functioning, he's flourishing because he's taking his medication, he's visiting his therapist, he's managing his stress level, he's taking care of all the triggers or the risks that can compound his mental health. So he's flourishing in the desert with cracks. Some cultural factors can also affect our mental health. So for instance, the beliefs we have in the system. So people believe that mental health is caused by witches and witchcrafts, or when you are cursed, or when you offend somebody and the person curses you, or when the gods are crazy or they are not happy with the things we are doing, we can have mental health issues. So we should be mindful of this, that mental illness is purely a health condition. But if you believe in these things, it can also compromise your mental health. So I'm not saying that it don't affect our mental health at all. They don't cause mental, so the witches don't cause mental health issues. But your belief in this can make you paranoid, can make you scared, worried. You don't want to go to work. Anytime you come to work, you spray every seat, every chair, everything that you have to touch. That can affect your mental health as well. Psychological therapy is indicative in helping us to manage our mental health issues. So there are a lot of things that psychotherapy can do for you. We help you to navigate the difficult times so that you can shed off some of the stresses that are impacting your mental health. Suicide prevention. So a lot of people with mental health issues, especially depression and schizophrenia, can commit suicide. Currently, suicide is a crime in Ghana, but those of us in the mental health fraternity are working hard to make sure that we decriminalize it, so that we rather help these people to seek for treatment. Now, statistics show that men are likely to succeed in attempted suicide than women. So, but the other side is that women are more likely to attempt suicide, more likely. But the success rate among women is very low. Success rate among men are very high. And then a lot of reasons have been cited for this findings, because women are believed to be more empathetic, and because they think about their wives, their husbands, and their children, they want to live for them. So a woman will take something that is likely not to kill her, and so they will survive the attempted suicide. They will take Omo, they will take some paracetamol in excess and other things. But the man will go for what will surely kill them, like the gun, or set the place on fire so that they'll be trapped and die. Okay, I remember a client, a woman, a lady, young lady I was seeing, and she was suicidal. But I saw it that she was using it to seek for attention, because she kept repeating, "I'll kill myself." The least thing, she wanted to kill herself. So one day she sent me a message that she wanted to kill herself. So I ignored her, because I know it was just attention. Because I've told her, if she needs to talk to me, she just call me or send me a message that she wants to talk to me, then we can talk. But threatening suicide is when I encourage it, I'm only reinforcing that behavior. That is not helpful. So I ignore her. And then in the evening, she sent me a message of what she should choose to commit the suicide. So she sent me a pile of medication, a picture of a pile of medication she wanted to take. And then after 10 minutes, when I didn't comment, she sent me a picture of a sharp knife that she has prepared to kill herself. I ignored that one too. But in about an hour or so, she called me and then we spoke. You get it? So like I said, women, when they tell they want to kill themselves, they want attention most of the time. And in fact, so let's be mindful, since we are all being educated, when somebody tells you they want to kill themselves, then they want attention. Someone who want to kill themselves will not inform you before they do it. So let's give them the attention. But when it becomes too much, then the attention is being abused. Let's refer them for treatment, since professionals know how to handle this people better in this light. Technology and mental health. So there are a lot of technology that can help us to support our mental health, improve access to mental health issues. When COVID came, a lot of online services were put in place. So currently I see about 40% of my clients online. So it has helped to help manage more people than when it was physical, because people were complaining about work, the distance to come to the consulting room. So it has helped. It has also increased patient engagement, like I just said. So it's helping. It has also helped to reduce stigma. Because of the stigma, even where I work, staff, people in the medical field don't want to see the psychologist or mental health professional. The stigma is huge. But because of the online and then other technologically based treatment models, we're able to see patients without exposing them to the stigma that they are so scared of. And of course, this has led to improved outcome in mental health cases. So technology is helping. But technology is also helping to increase isolation. People are becoming more isolated because of the technology they have. They prefer WhatsApping and then going off. When I'm physically present, you can engage me, even if I want to avoid you. But when I am with my phone, you can call me and I will not pick, because I know whatever is happening. I can go online and check that things are happening, and then I will not pick your call. I will not engage you, and I'll become socially disengaged. It has also led to higher level of anxiety and depression because of the fear. So because when you meet me, I can talk to you and then you become calm, even at the workplace. If I'm scared that my boss will punish me because I didn't do something wrong, going to see my boss will help to explain things. But I can hide behind the internet and then send a message that I'm not well, I won't come to work, or maybe do an online consultation with a doctor to get an excuse. And the more you do that, the more you alienate yourself, you isolate yourself, the more depressive you become. The more you promote the fear that you have. Technology has also increased or worsened sleep disorders. So people who are suffering from sleep conditions or disturbances, because if they're not sleeping, they're able to get access to their phone or their tablet or their laptops and then watch a movie or do something else on their computer. And so sleep will not come. The brain is said that what you train it, that's what it does. If you're not sleeping and you are watching a movie or you're doing something on your laptop, you are telling your mind that you don't need a sleep. This is what you need. So your brain will encourage you more, and very soon you won't be able to sleep at all, even if you don't have the laptop. It has also caused a lot of addiction. So some have become addicted to their machines, and then they won't go anywhere or they won't go to eat their food because of that. In all of this, let us remember that the power is yours. You have power to make a lot of decisions. You have power to report your symptoms, to consult a therapist or a professional, talk to your bosses, your husbands and wives, talk to your pastors about what you are going through. Don't die alone. At least talk to someone so they can help you not to die in the first place. So that even if you want to die, even if you want to die because you have to die because of the medical condition that you are going through, you don't have to die alone. There are a lot of grief counseling that we can offer. There's a lot of counseling that we give to people who are about to die before even they die, to prepare their minds to do that. And that power lies within you. The human being has enormous power to heal. In mental health management, we use the power that is deposited in you naturally to help you heal. Because for those who have gone for therapy, you realize you're not giving medication. You are told things that you have the capacity to do. We help you to reawaken the strength, the healing power within you to help you to do that. So make sure you use that power to help you to work on. I will conclude by saying that mental health is a vital aspect of our overall well-being, affecting individuals' thoughts, mind. So it affects my thoughts, it affects your thoughts, your emotions, and your behavior. It is therefore crucial that we prioritize our mental health. Let us all seek for support. Let us all promote awareness to ensure a healthier and happier society. Back at your workplaces, let's talk about mental health like nobody's business. That's the only way we can reduce the stigma and then the discrimination that's connected to it. Thank you very much for listening to me.
Thank you so much, Doug. for your insightful presentation. We really appreciate your time spent with us and educating us on this vital topic. We are so much grateful. We don't take it for granted at all, and we know that next time when we call on you, you will come. Thank you. At this time, we just want to take some few acknowledgements from our attendees. We have Mamudu Barry from Conakry, Abayomi Agori, Nigeria. We have Bright Frimpong from Ghana Air Force. We have Franchmeni Training from Cote d'Ivoire. We have Dao Aliu, Mauritania. Festo Banda from Zambia. We have Nicolene from ATNS. Cosma, Malawi. Evans Frimpong, Ghana. We have Konati, Malawi. Alicia, English from Jamaica. Big ups. Tony Kepler from Uganda. Thank you so much for joining us. Thank you so much for having us. In line with the International Air Traffic Controllers Day, we want to receive some few messages from our colleagues. Do stick and stay, we'll be right back.
Zama Mensah, the president of Ghana Air Traffic Controllers Association, GATCA. On this day, as we celebrate air traffic controllers across the globe, I want to wish all controllers a happy International Air Traffic Controllers Day. And guys, let's keep keeping the skies safe. Thank you.
Hello, everybody, especially to ATC controllers around the world. My name is Sidney Ribeiro. I am a captain for Passion Air in Ghana. I want to take this opportunity to wish all ATC around the world a happy Air Traffic Controllers Day. Keep up the good work. That keeps our skies safe. Thank you.
Happy Air Traffic Controllers Day to all the air traffic controllers across the world, especially my Ghanaian peace, ATC. Big up, big up, big up.
My name is David Okomoboatin, the Deputy Director of Air Traffic Services in the Ghana Civil Aviation Authority. I would like to say I equal to all air traffic controllers in the whole wide world, and in Ghana in particular. Thank you, and may God bless us all.
Hi everyone, my name is Henrietta Nate and I work as a personal assistant in Ghana Civil Aviation Authority. I want to take this opportunity to wish all air traffic controllers a happy International Air Traffic Controllers Day. Keep up the good work and wish you the very best in the years ahead.
Hi everyone, I'm David, a controller from the Isle of Man in the British Isles. I'd like to wish all air traffic controllers from around the world a great International Air Traffic Controllers Day. Keep up the good work in keeping all our skies safe.
Hey everybody, I want to wish you a happy Controllers Day. And this is coming all the way from Jamaica. I want to big up every air traffic controller across the world, across this earth that we know, that has worked so hard to ensure safer skies. I really want to hope that each of you are enjoying this day, because this is a day that we should celebrate. I want to also thank the Ghanaian contingent who have worked hard just to put this together as we big up everybody. Bless up yourself from Jamaica.
Hello everyone. My name is Daniel Aqua, the Deputy Director General Technical for the Ghana Civil Aviation Authority. In connection with the Air Traffic Controllers Day, I wish all air traffic controllers in Ghana, near and far, a happy Air Traffic Controllers Day. And please keep up the good work that you've been doing to keep our skies safe. Thank you.
Hi folks, We are the Indonesian Air Traffic Controllers, and we wish you a
Happy International Air Traffic Controllers Day. Keep the sky safe.
Hello, I am Estasafo Kantanka of the United Nations Humanitarian Air Services. On the event of the International Air Traffic Controllers Day, I want to say Ayuko, well done to air traffic controllers all over the world. You are doing a good work. It is because of you the birds are flying without fear. Thank you for all you do. Happy International Air Traffic Controllers Day.
Hello everyone, my name is Araba Sumpaminai from Belarus, and on this day I want to wish all air traffic controllers a happy Air Traffic Controllers Day. Without you, the skies will never be the same. Thank you. Bye.
Hello, I'm Mehdi Dubari, Air Traffic Controller from Algeria. I'd like to wish to all ATCs around the world, happy International Air Traffic Controller Day. Keep up the good work you do to keep the skies safe. Cheers.
Hello guys, my name is Vincent Okolai, an Air Traffic Controller with the Ghana Civil Aviation Authority. And on this special day, I want to wish all air traffic controllers in Ghana and across the world a happy Controllers Day. Let's continue to keep the skies safe. Thank you. Bye.
Hello, I'm Maureen.
I'm Lorenzo. I'm Hensing.
We are from the Bahamas. We want to wish all air traffic controllers around the world a happy International Air Traffic Controllers Day. Keep up the good work.
I am Akwesi Ejebi Pembe, the Commissioner for Ghana Aircraft Investigation Bureau. I would like to take this opportunity to congratulate our team of air traffic controllers for exceptional work and contribution to air traffic control within the Accra Flight Information Region. AICO.
Hello everyone, good afternoon. My name is Sally Degolo from Ghana Civil Aviation Economic Regulation. I want to take this opportunity to wish all air traffic controllers a happy International Air Traffic Controllers Day. Keep up the good work. Thank you. Bye.
Greetings to all my fellow controllers around the world. Happy International Controllers Day, especially to my Ghanaian fellow controllers doing the job.
Hello everyone, this is Jane Okumu, an ATC and Aviation Safety Officer with the UN mission in South Sudan. I'd like to wish all ATCs happy Air Traffic Controllers Day. You do a good job. You keep the skies safe. Keep it up.
I am Engineer Muhammad Asunga Abdullahi, the President of Ghana Air Traffic Safety Electronics Association. As we celebrate International Air Traffic Controllers Day, I wish on behalf of all ASEP in Ghana to say a big happy International Air Traffic Controllers Day to ATCOs in Ghana and the whole world.
Hello everyone, I am Maureen Isika, an air traffic controller from Nairobi, Kenya. I want to wish all air traffic controllers around the world a happy International Air Traffic Controllers Day. Keep up the good work you do in keeping the...
My name is William Stechi, Human Resource Manager at Ghana Civil Aviation Authority. On the occasion of the International Air Traffic Controllers Day, I want to wish all controllers a happy and a wonderful day. We value your contribution to this industry, and we know how hardworking you guys are. We want to wish you all the best, and then continue shining and keeping our skies safe all the time. Thank you.
Happy Air Traffic Controllers Day to all controllers. Ghana controller, big up.
Hi there, my name is Annabelle from Orlando, Florida, and I'm here to wish everybody a happy Air Traffic Controllers Day. Keep up the good work and keep the sky safe.
Every 20th October is World Air Traffic Controllers Day, and on this auspicious occasion, I wish to congratulate our hardworking air traffic controllers for their dedication to duty and ensuring that Ghana's airspace in Accra FR remains safe and one of the best in the world. Congratulations.
Hi everyone from Accra, Ghana.
we'd like to wish all air traffic controllers all over the world a happy
International Air Traffic Controller.
All right, my name is Francis.
Thank you so much to all those who sent us videos from all over the world. We really appreciate it. Thank you. Welcome back. And thank you for staying with us. Throughout this webinar, we have delved into the specific stresses faced by industry players, and we have explored various strategies and resources for managing these challenges. Our distinguished panel of speakers shared their insights and experiences, which I hope have been empowering. We've also learned about the things that can lead to a short recap. We've learned about things that can lead to stress, a nature of a selection and training, working conditions and environment, irregular working hours, family challenges, heavy workloads, among others. We also saw in this webinar common stress, depression, anxiety disorders, drug and alcohol abuse, self-harming, losing interest in sex. And we also looked at how to identify signs. We saw low performance, missing job and reporting for work late, constant sick leaves, sleep disorders, angry, frustrated over minor things. And both speakers share some stats with us, which are very alarming. And I think the one that struck with me, it's 41% of Ghanaians are currently experiencing psychological distress. Wow. The stats are very scary. And we need to take so much interest in mental health. Aviation professional mental and physical health is non-negotiable. It is non-negotiable. And everyone has the right to mental health. There is no health without mental health. And it is okay not to be okay. And for that matter, we should not be too hard on ourselves, but rather speak up and seek for support. Hashtag, the power is in your hands. The power is yours. Right. We'd like to open the floor for some questions. Please feel free to share with us your questions, experiences, and suggestions. And we'll do well to address it as many as we can, as time may permit us. Our first question for today, it reads, Doug, will you recommend adding psychiatric evaluation to the annual ATCO medical checks? I believe this goes to Dr. Akparibu.
Hello. Yes, please. So like I mentioned in the presentation, the Aerospace Medical Association made a recommendation which includes that AMAs should do a psychological assessment on all air crew that come in for their medicals. So if you look at the medicals, if you look at the South African one, there's a portion that you evaluate the airman's mental health. Also, the Australian one also has a section like that, and then also the FAA. So it's something that the Ghana Civil Aviation Authority can also look at. We could add the portion on mental health screening to the medicals.
Thank you, Doug. Our next question. What are the primary stresses experienced by aviation professionals in their work environment? And how do these stresses vary among different roles within the aviation industry?
Okay. So maybe I can take that.
Yes, please. Yes, please, Doug.
Yeah. So, like I mentioned earlier, based on the roles that people play in the aviation community, then there are peculiar stresses that such persons also undergo. So if you take pilots, I said their working conditions vary, say confined space, you have background noise. You know, air traffic controllers, they also have to sit for long hours, look at display screen equipment, eye strain, you know, look at the night shift, the schedules and all that. Cabin crew is the same, the shift work. And then also they also have like background noise, you know. The engineers also work for long hours, they work in the sun to make sure they fix equipment, you know. So there are like personal stresses that like are peculiar to like the various aviation professionals. And there are some of the things I just mentioned. I don't know if I've answered the person's questions.
All right, thank you. Our third question goes to Mr. Eric Owosukumi. It reads, being a male also has its own concomitant problems. Example, stress from keeping food on the table daily for the family, etc. I think to single out the female is a bit debatable, or you don't see it that way, Mr. Eric.
Thank you very much, Mr. Questioner. What you are saying is true, but because of the supposedly discrimination, you see, it is the mental health issue, the focus is more on the men. But I can assure you that men also have their own mental health difficulties or challenges. The problem is men are not likely to go for management. And so if you walk into any treatment facility, you find close to 80% women visiting. The men are not coming, even though they get referrals, all right. They don't go for their mental health management. But I mentioned those factors because those factors are natural. We can't control them, especially the hormonal and then the fact that they are physically different from men. Those factors push them at risk. So there are things that men don't have. But of course, in the cultural setting of Ghana, men are supposed to put food on table. So even if the woman earns more than men, the man is still required to make sure that there's food on the table, the school fees are paid and all of that. So in some families, the woman, the role is shifted to the woman. It becomes a mental health issue for the man. So it is true partially, but because of the genetic and then the factor that you cannot control, that's why I singled out the women. Women are the only ones who become pregnant. Women are the only ones who have the abortions and then the complications. The men will suffer, but the woman who gets the direct impact. Thank you.
And then maybe just to add to that, there's also like an element of what we call resilience. You know, I think men probably are more resilient compared to females, you know.
Right, thank you. Being a woman, it's not easy. Our fourth question goes to Mr. Eric. Do you have suggestions if someone suddenly have panic attack? How do we reduce it fast when he or she is doing, he or she is on the job and he had a panic attack?
Okay, thank you. Thank you very much. So one of the quickest things you can do is to do the breathing exercise, which is a very common exercise. So I'll just demonstrate it for us, because the moment you panic, there is an alarm system that is saying that there's a threat. So your nervous system responsible for activating everything that needs to be activated for you to fight the threat comes to play. And breathing is one of the things, because you need oxygen to burn the energy to become active to fight the threat. So quickly, when you go through panic, your breathing increases. However, when your breathing increases and you're not able to utilize the extra oxygen that is being produced, it will make you have what we call the respiratory alkalosis, where there's so much carbon dioxide being produced when there's not oxygen being burnt the way it's supposed to be burnt. So what you have to do is to control your breathing. So breathing exercise means that you take in deep breath, okay, at a controlled pace. So you breathe in slowly through your mouth, and then, you breathe in slowly through your nose, and then you breathe out slowly through your mouth. So whilst you are doing that, you are controlling the amount of oxygen entering your system and then the carbon dioxide that is being produced. And that will lead to you reducing the symptoms that come as a result of the panic. So that is one thing that you can do. Then if you've also learned how to do grounding techniques. So grounding just means that moving from your head and entering into your environment. Most often when we panic, we are doing so many things in our minds in a very quick fashion. So all you have to do is to move out of your mind or come out of your thoughts and then enter your environment by engaging your sense organs. So your organ to see, so eye. So just begin to see things in your environment and engage them. Begin to listen to sound in your environment and engage them. Begin to feel things on your skin. Okay, begin to, if there's something in your mouth, begin to taste it the way it is. So by grounding, you can also reduce panic instantly. Then you can also do the progressive muscle relaxation, which is also thoughts. So you tense your muscles and then you release them at will. The moment your mind is off the thing that is causing the panic, the chance that your panic will reduce is very high. Thank you.
Okay. Thank you, Doug. Next question. Is there a report system where suspected staff suffering from mental health problems can be reported, and how do you go about it?
Any of us can answer, or it's me?
Yes, please.
Okay, so ideally, for any institution that has a mental health policy, then there's usually a focal person who is responsible for this thing, or a peer counselor. Some people call it the peer counselor. And so most staff members should know of this person. But if that doesn't exist, the best thing is try to avoid stereotyping and using words that will make the person who is mentally unhealthy become worried. Let's remember that when somebody has a mental illness, some of them have their insanity compromised, okay? And then others too lose the capacity to perform mental functions. Some may also have delusions, okay? And they may suspect people unwarrantedly. And so the moment you begin to make certain comments and statements, you worsen the person's plight. So we should be non-judgmental about what is happening and be very supportive. We should be kind, gentle, and empathetic. These factors will help these people to either talk about what they are going through or will be ready to seek for support and external support from the therapist. So if you don't have any system, you report to your immediate boss, who should be able to have this characteristics that I mentioned, so that he goes through the person. At the moment, because of the stigma, let's remain quiet and confidential about these people, and because that helps them to be forthcoming with information and then be willing to go for treatment. Thank you.
Thank you so much, Doug. We would want Mr. Akparibo to We want to have Mr. Kparibu's view on that. Is there a report system where suspected staff for mental health problems can be reported, and how do you go about it?
So I think this has to do with your like HR. You know, like I mentioned earlier, they are like you need to have like employee assisted program, or you have like a peer support group. So you could form like ATC could form like a peer support group that would support colleagues that have mental issues. So colleagues that have mental issues could call the peer support group and then get help without being retaliated or victimized, or maybe disadvantaged in terms of maybe job schedules and stuff. So I think all this has to do with the employer. So the employer has to decide if they want to have an employee assisted program, and which is actually proven to work. So that is my recommendation. My recommendation is for you to have that.
Right, thank you so much, Doc. Our next question goes to Mr. Huwosu Kumi. What coping mechanisms and stress management strategies do aviation professionals currently need to deal with workplace stress, and how effective are these strategies in mitigating the negative effects of stress?
Until this is your question now, dear. so
I believe that your mic is off.
My mic is on. Can you hear me?
Okay, we can hear you now.
Okay, so the question is asking require a lot of work. One, every person has a different level of stress, and then our coping strategies also differ from one person to the other. There are other factors that also influence the way we manage stress. So for us to do this well, we will need a full stress assessment and then a stress training program. However, a quick one will be, I've mentioned two things. The breathing exercise, everybody should know how to do it so that you can use it to attack stress immediately. So panic attack and stress management, they have similar features of attacking. So the breathing exercise, the progressive muscle relaxation, and then the grounding techniques, they are all good strategies to help you to manage stress. Okay. Then there are positive coping strategies and negative coping strategies. One of the positive ones is having good problem-solving capacity or ability or skills. Then the second one is to have a good social support system. And so in some institutions, the workplace even has a social support, but you need more than just the work. You need the family, you need your church or your religious belonging or association. You also need, these days, a lot of old students support system are available. So if you have about 5 social support systems, then the chances that you go through stress for a very long time is almost zero, because you can count on all these people to support you to manage it. Okay, so then also we should be able to talk, express how we feel. It's a very powerful coping strategy. If you can't talk to the one who's hurting you or causing you the harm, talk to somebody who can talk to the person. If you can't talk to the other person, talk to a professional. So come and see a counselor and talk to the counselor about what you are going through. That's one way to express yourself. If you can't do this, to write. Okay, writing is also a good way to express how you feel. You can write to the person or write it and then destroy the document. If you think it's bad that you cannot, nobody can see, destroy it. The fact that you are writing is a cognitive activity. You are processing the thing in your mind. So maybe I have offended you. I am your boss. You cannot face me and talk to me about it because of my nature. You can say all the things you want to say to me on a paper. You can say all the things you want to say to me on a paper, and then after that, you destroy it. Okay. Then the last good coping strategy is to learn how to do what we call cognitive restructuring. If you can't change somebody, change the way you think about the person. Maybe say something that is nice to yourself, something that will be okay for you. So, for instance, you can say that, okay, we know, for yourself, for your own sake. So you have changed the way you think about the person, because you can't make the person change their behavior. Just tell yourself that I cannot change this person, but you can change yourself. So these are some good ways of coping. Thank you very much.
If you can't change somebody, change the way you think about the person. Thank you so much. Our next question goes to Dr. Akparibu. What are the long-term implications of unaddressed mental health issues and chronic stress among aviation professionals, both for their individuals themselves and for the safety and efficiency of aviation operations? I'll take that again. What are the long-term implications of unaddressed mental health issues and chronic stress among aviation professionals, both for the individuals themselves and for the safety and efficiency of aviation operations?
Okay. Yeah. So I would say the long-term consequence is exemplified by the German wings accident, like I mentioned. That particular pilot started having issues when he was undergoing training in the US. He had depression that wasn't addressed. And then he saw several doctors, but unfortunately, he did not see like an aviation person who could ground him. The very day that he committed suicide with the aircraft, he went to see a doctor. The doctor gave him an excuse duty, and then he went back to his apartment, tore the excuse duty, and threw it into a bin. If he had seen an aviation doctor, the person would have grounded him. He would have just given an excuse duty without grounding. So the long-term consequence to the system is normally catastrophic. Now, with the consequence on the individual, one, you could have loss of employment. If you don't go through the program, if you have mental illness, you don't go through the treatment program, there's no way that we're going to restore your licenses. And if we don't restore your licenses, you're going to lose your livelihood. So we've had like an example, even in Ghana here, the airman had an episode and didn't want to go through the program. And once he didn't do that, we insisted that such an airman could not fly. And there's lots to follow up, because as it is now, I don't know where that particular airman is. The airman is no more working with the company that observed the problem and reported to the Civil Aviation. So these are like some of the consequences. So there's like an impact on the individual itself based on like the person's economic situation, even family issues can lead to divorce and that kind of stuff. And also consequence on the whole system, which is normally catastrophic, is the whole system that we don't want to happen. That is where we would want to avoid, because if it happens, you have so many lives that you normally lose. Okay, thank you.
Thank you so much, Doug. We have a lot of questions here, but unfortunately, we cannot put all out here due to time constraints. But would send it to the doctors to address it, and then we can load it on our website. Before we wrap up, please take a moment to complete a brief feedback survey as you exit the webinar. Your feedback will help us improve future events. Do follow GATCA on our social media handles. That is Facebook, IG, Twitter. Also, you can send us feedback regarding this webinar to info@gatca.org. info@gatca.org. Please note that this webinar will be uploaded onto the GATCA website as well as our YouTube channel.
Okay, Oye, let me quickly add this. Hello?
Yes, Doc.
Yes, I want to remind staff of civil aviation that your institution has a collaboration with the Trust Hospital for anybody who is suffering or going through any mental health challenge or any psychological distress. They can walk in, and then the psychologists here will see to their mental health. Thank you very much.
Thank you so much for this information. Very timely. We appreciate it. On behalf of the Ghana Air Traffic Controllers Association, I would like to say a very big thank you to our incredible speakers for today, Dr. Akparibu and Dr. Howosu Kumi, for accepting and making time out of your busy schedules to join us. Not just that, but have shared your insightful thoughts on the subject matter. We don't take it for granted at all. We are indeed grateful. I would like to thank every attendee who made time to join us as well. Keep joining our subsequent webinars as we share industry insights. Our sincere thanks to GCA management, ATC management, IT section, and the crew for their continuous support. I'd like to thank the president and all members of GATCA, most especially the members of the technical team and our media partners, Aviation Ghana, Ben, Alisa, Samani, Kwamina, Alaska, Jonah, Oko, John, and all members of the team. Big ups to you, big ups. You have been amazing. Once again, on this International Air Traffic Controllers Day, we salute and appreciate the incredible professionals who keep our skies safe. Your work is invaluable, and we are deeply grateful for your service. Ladies and gentlemen, all too soon, we have come to the end of another special edition of the GATCA Technical Webinar Series. So we come your way again with another edition. Let's prioritize our well-being and continue to work together to create a safer and more supportive environment in the aviation industry. My name is Evelyn Oyelamte. I must admit, it has been an honor to be your moderator for today, and I'm deeply grateful for your active participation. Please stay well, take good care of yourself, and cheers to another year of success, safety, and continued excellence in air traffic control. Thank you for your incredible contributions to the world of aviation. Do have a pleasant weekend. Cheers.
The president of Ghana Air Traffic Controllers Association, GATCA. On this day, as we celebrate air traffic controllers across the globe, I want to wish all controllers a happy International Air Traffic Controllers Day. And guys, let's keep keeping the skies safe. Thank you.
Hello, everybody. Especially to ATC controllers around the world. My name is Sidney Ribeiro. I am a captain for Passionate in Ghana. I want to take this opportunity to wish all ATC around the world a happy Air Traffic Controllers Day. Keep up the good work. That keeps our skies safe. Thank you.
Happy Air Traffic Controllers Day to all the air traffic controllers across the world, especially my Ghanaian peace, ATC. Big up, big up, big up.
My name is David Okomoboatin, the Deputy Director of Air Traffic Services in the Ghana Civil Aviation Authority. I would like to say I echo to all air traffic controllers in the whole wide world, and in Ghana in particular. Thank you, and may God bless us all.
Hi everyone, my name is Rita Nate and I work as a personal assistant in Ghana Civil Aviation Authority. I want to take this opportunity to wish all air traffic controllers a happy International Air Traffic Controllers Day. Keep up the good work and wish you the very best in the years ahead.
Hi everyone, I'm David, a controller from the Isle of Man in the British Isles. I'd like to wish all air traffic controllers from around the world a great International Air Traffic Controllers Day. Keep up the good work in keeping all our skies safe.
Hey everybody, I want to wish you a happy Controllers Day. And this is coming all the way from Jamaica. I want to big up every air traffic controller across the world, across this earth that we know, that has worked so hard to ensure safer skies. I really want to hope that each of you are enjoying this day, because this is a day that we should celebrate. I want to also thank the Ghanaian contingent who have worked hard just to put this together as we big up everybody. Bless up yourself from Jamaica.
Hello everyone. My name is Daniel Aqua, the Deputy Director General Technical for the Ghana Civil Aviation Authority. In connection with the Air Traffic Controllers Day, I wish all air traffic controllers in Ghana, near and far, a happy Air Traffic Controllers Day. And please keep up the good work that you've been doing to keep our skies safe. Thank you.
Hi folks, we are the Indonesian Air Traffic Controllers and we wish you a
Happy International Air